you guys for bringing me in today. I just couldn't find the motivation to get here by myself.
Yeah, well, I mean, I guess we're here for you, but this depression thing, you really gotta get it under control.
Well, depression is a real mental illness. Let's not blame her.
We're here for you, but
Hi, I'm your nurse Seth today. You're talked to the provider earlier about some of your depression and anxiety symptoms, and he prescribed sertraline for you. So we're going to talk a little bit about that today, all right?
okay. Great.
So you said it's called sertraline and it helps with my depression, but I'm also feeling anxious, so what about my anxiety?
So sertraline is an antidepressant that is prescribed for clinical depression, but one of the unlabeled uses is also for generalized anxiety. So there's a chance that it might also help with your anxiety along with the depression.
Okay, so it would target both. Okay, so I've had some trouble with medications before in the past. I experienced all the side effects, so I'm a little hesitant to be taking a new medication. What kind of side effects does this medication have?
So the medication can cause insomnia, which is difficulty sleeping or staying asleep. It can cause some agitation, some nausea, some dizziness, constipation, diarrhea, dry mouth, and you might feel a little tired while taking it.
Okay, those don't sound too good. I'm not quite sure if I want to start taking that medication.
Listen, I really think you need to get this depression under control. It's had such an impact on your life, and it really affects you, and you can't even get out of bed sometimes. I really think we need to get this under control, and this might be worth it.
Yeah, and maybe if the nurse tells you how the drug works in your body, it could ease some of your anxiety about it too.
So, how does this drug exactly work in my body?
So sertraline is what's called an SSRI, which is a selective serotonin reuptake inhibitor. To numb that down to easier terms, essentially serotonin is a hormone in the body that induces, the feeling of being happy, and the body will secrete it, but it will also take it back in to resecrete it. So this medication just blocks the body from doing that. Therefore, it'll end up increasing the levels within the body to combat the feelings of depression.
Okay, so you're saying that the medication helps me regulate those happy hormones better and make me overall less depressed?
Yeah, it'll just work to increase the levels to keep the body from pulling too much of it back in.
Okay.
If you remember earlier, also we took some blood, so we ran some samples on that, or some tests, and the tests came back and your liver's functioning well, same with your kidneys, and you don't have any excess thyroid hormones in the body, so everything's looking really safe for you to take the medication. We also had you take a pregnancy test too, just to make sure you're not pregnant, because the medication can't be taken if so, and we did take a baseline weight.
Okay, so I think I decided to take this drug. What do you guys think?
Well, I think we should know maybe a little more about the drug before we agree to take it, because although we do want you to be taking it for that depression to help it go away, we should know more about it. So I want to know about, like, how long is this drug going to take effect? How long is it going to take for it to start working? And does it, like, last for a long time, or does it just, get out of the body like that?
Go.
So when she starts taking the medication, it might take up to a week, maybe a little longer for it to start taking effect. For the drug to continue working though, you are going to need to keep taking it, and in the case that you've been taking it long term and start to experience side effects, you're not going to want to discontinue it rapidly, otherwise you can have some pretty uncomfortable side effects from that as well, so we'd have you kind of wean off of it.
So basically what you're saying is that it takes about a week to kind of kick in and start working. But I'm a med student, and I also learned that there's like some pretty serious side effects of taking SSRIs. Is there any that like we should be concerned about?
So serotonin syndrome is one of those adverse side effects that can be serious. It's when the body has too much serotonin in it, and the symptoms of it would be agitation, nausea, vomiting, diarrhea, shivering, sweating, and muscle twitches. And so if you experience this, we want you to contact the provider immediately. Another one is going to be suicidal ideation. It's most common in the first week of taking the medication, but can occur at any time. It's, when you have thoughts of suicide, self-harm, and just anything of that nature. And if you feel any of that or have any of those thoughts, we want you to contact the provider immediately as well.
Okay, so what you're saying is this thing called serotonin syndrome. I will have to look out if I have nausea, vomiting, diarrhea, muscle twitching, sweating, shivering. If I get agitated, I should call the doctor.
Yeah, I think that's what he said.
He also said something about suicidal ideation too.
Oh, yeah, if I have thoughts of harming myself, I should call the doctor as well.
So are there any reasons she shouldn't be taking this medication?
Well, I know the nurse already said that her labs are all normal, so I don't think we have to worry about that with her. But I do know she's taking some vitamins and supplements, and I know other drugs may interact with this. Is there any interactions we should be aware of?
So for stuff like supplements and vitamins, I'd have to consult with the provider on that. There's a possibility of that, but I can get you a better answer once I talk with them. You'll want to avoid the use of other central nervous system depressants, so things like alcohol. You're not going to want to drink alcohol while taking this. You have an increased risk of bleeding if you're on any anticoagulant medication, any over-the-counter NSAIDs like ibuprofen. If you're taking anything that's going to mess with your platelet levels, or if you're taking any salicylates like aspirin. Yeah.
Okay, so I don't think any of those interactions apply to me. I can hold off on taking my vitamins and supplements till we know what the doctor says, but I'm not on any blood thinners, and I don't really drink alcohol, so that shouldn't be a problem. So I think I'm ready to take this medication. What dose will they start me on?
So they're probably going to start you on about 25 milligrams, and depending on how things go, they could leave you at that, or they might move you up eventually. But don't do that on your own. The provider will tell you if you should do that or not. They're going to be in a pill form. If you have trouble taking pills, you can crush them. You don't need to take it with food, but you can if your stomach gets upset when you take it without food. And it doesn't really matter what you take it with. You can take it with anything. And yeah, you're going to want to increase fluid intake while you're taking this medication, since constipation is one of the side effects. Increasing fluid intake is going to help combat getting constipation. And then you're going to want to store it in a dry place, and you're not going to want to freeze it.
That shouldn't be a problem. I always have my water bottle.
Okay, so just to make sure we're understanding everything correctly, we won't let her take a dose that's over her prescribed dose of 25 milligrams yet, and we'll wait for the provider if we need to do that. And the effects will be seen in, what was it, a week?
A week, I think, a week.
Okay.
Yep.
And then the symptoms, the side effects that she may have are insomnia, agitation,
Dry mouth,
constipation was
Yep.
one too.
Mm-hmm.
And she should increase your fluids for those. So we'll try to help her make sure she's drinking lots of water.
Also, in the first week, she may have increased suicidal ideation, so we'll have to watch for that too.
Yes.
For signs of that.
Yeah, and then the symptoms of
Serotonin syndrome. Yep.
And we should call the doctor for those symptoms
As well, yep.
Yeah. Okay, so those are the most important things that we should look out for.
Is there anything else that we should know?
Yeah, so I did forget to mention she should not operate any vehicles until she knows how the medication does affect her. And if she does experience those adverse effects, definitely give us a call and don't discontinue the medication, because that can cause side effects on its own. And I do hope that this is an effective treatment for her.